call it pre-existing condition, etc., a bunch of fine print that led to people not having health insurance. So that was one thing that we said. We said also, you can keep kids on your health insurance till they're 26. That children with pre-existing conditions had to be covered under health insurance. So there were a handful of things that we said insurance companies have to do, just as good business practices to protect consumers. But otherwise, you can stay on your employer's health care. So that's if you have health insurance. The other thing we did was we said, a lot of people who don't have health insurance is because they work for small businesses who have trouble affording health insurance because they're not part of a big pool. They're not like a big company that has thousands of employees and they can negotiate because the insurance companies really wants their business. So what we said was, let's provide tax breaks to small businesses so they're more likely to buy health insurance for their employees. And right now, about 4 million businesses across the country are now getting a tax break, a tax credit if they provide health insurance for their employees that can save them tens of thousands of dollars. So that's the second thing. And the third thing we said was, okay, if you don't have health insurance, so let's say, just say your job doesn't offer you health insurance or you lose your job, then what we're going to set up is what's called an exchange, which is basically a big pool. You become part of this big group of people, just like as if you were working for a big company or a big university like Drake. You become part of this pool, and you'll be able to buy your own insurance through this pool, but the rates will be lower and you'll get a better deal because you've got the bargaining power of these thousands or millions of people who you're buying it with. You'll still have a choice of plans. You'll have a choice of Blue Cross, or you'll have a choice of this plan or that plan, but you'll be buying it through a pool. And if you can't afford it, then we'll provide you some subsidies to see if we can help you buy it, so make it affordable. So that's essentially what health reform is about. Now, what that means is that you're not going to be forced to buy a, quote, government-run healthcare plan. The only thing that we have said is that if you can afford to get health care and you're not getting health care, well, that's a problem, because that means when you get sick and you have to go to the emergency room, everybody else here has to pay for it. And that's not fair. So we've said if you can afford to get health care, we're going to make sure that you can afford it, but you've got to have some basic coverage so that we're not subsidizing. Everybody else is paying an extra $1,000 on their premiums to cover you.
We're all well agreed. Okay. There needs to be health reform. Okay. We just moved down here a year ago from Las Vegas.
Right.
Okay. There are illegal immigrants that are getting free health care right now. Okay, the doctor we had clinics and stuff closed up because they couldn't even afford to stay open because of all the illegal immigrants that were getting health care.
Well, let me do this, because I'll answer this question, then I want to make sure everybody else gets a chance too. But I think this is important for me to be able to clear up some stuff. There's no doubt that there are probably a number of hospitals in every major city, doctors in every major city, who are providing uncompensated care to a whole lot of people, including some illegal immigrants. I mean, basically, most doctors and nurses that I meet, their whole reason for being in the profession is to help people. And so if they see somebody coming into the emergency room, if there's some child who's badly injured or sick, they're going to not check on their immigrant status. They're going to say, this is somebody who needs help. I think that that's the right thing to do for our society generally. I think it is very important for us to make sure that we have compassion as part of our national character. Now, The thing I want to point out, though, is that, first of all, there's nothing in my healthcare plan that covers undocumented workers, right? So that's not part of health reform. And the second thing is, it turns out actually illegal immigrants probably underutilize the healthcare system. The only time they go to the healthcare system is if they have an emergency, because, for the most part, they're worried about getting caught. So that's not to say that there's not a portion of that population that is getting uncompensated care that's adding to our costs, but you know, there are a lot more Americans who don't have health insurance. As a consequence, don't get regular checkups, aren't getting preventive care, are more likely to end up in the emergency room, are more likely to add to the cost of the hospitals or the doctors. And so if we can provide them with basic checkups, basic preventive care, affordable health care, so they've got some peace of mind, that will actually, over time, make the system more efficient as a whole, because emergency room care is the most expensive kind of care. But I guess the main message I just want to communicate, because there was a lot of misinformation during the healthcare debate. I just want to communicate that if you're happy with what you got, nobody's changing it. And you and your mom are going to be able to have, your mom is going to have her Medicare, and the core benefits of Medicare aren't changing. And if you've got health care through your employer, that's not going to change, except to make it a little bit safer and more secure. If you don't have health care, then it's just going to help. And overall, independent estimates say that this is not going to add to our deficit, it's actually going to reduce our deficit, because we're making the healthcare system more efficient over time. But I understand why people are concerned, because this is a very personal thing, and nothing's scarier than when you don't have health care and you're sick. I've told the story of when Sasha was 3 months old, she got meningitis. I still remember going to the hospital, and she had to get a spinal tap, and I never felt so helpless and scared in my life. And I was lucky to have health insurance, but we were in the emergency room looking around and thinking, well, what if I was one of these other parents who didn't have it, and my daughter was going through this? And I was thinking, I'm going to get a $20,000 or $30,000 bill after this, and I have no way of paying for it. Or what if my child has a chronic illness? And so it's not just a one-time trip, but it's trip after trip. And, I don't think any parent should have to go through that, not a society as rich as ours. But thank you for the question. It's helpful.